meeting. There's the recording.
Now they should be able to see us.
Now we're official.
Jorel, is that you?
Excellent. Okay, well, welcome everyone. Thank you guys for bearing with us. We had a little technical difficulty, but I think we got it figured out. Now I'm on 2 cameras. Necessary. Excellent. Okay, welcome. Kate is taking attendance kind of as we speak here. We'll pass doing a full round robin. I'm assuming we have quorum.
It looks like we do.
Okay.
Yes.
Excellent. Okay, we have a full agenda, so we're going to dive in today. Is there anyone in the room here or on Zoom who wants to offer up some public comment? Yes.
I'm Lanny Ball. I'm from Cottage Grove. Uber, Lyft driver, DoorDash, Grubhub, all.
Lady, I'm going to stop you. Do you mind coming up to the table and talking to a microphone? Then everyone at home can hear you too. And you're welcome if, oh, sure, that works.
Thank you. Yeah, it's a privilege to be here. I was just wondering, I came in last Thursday, no one was here. What happened? Was it closed? The last meeting last month on a third Thursday?
Oh, that meeting was at a different location.
Okay, I didn't get it. My fault. I didn't research it. Anyway, I'm Lanny Ball. I'm from Cottage Grove. I've been concerned about, well, I'm a Christian man, and I'm concerned with the homeless situation in your town, Springfield, and surrounding areas, and all over the country, actually. I have a lot of ideas, and I told
Kate.
Pete,
Kate.
oh, Kate, that I would talk in depth about it later, but I've got so many ideas. And I know you've got so many implemented here in Eugene, Springfield, mostly Eugene. I don't know if I'm going to say it anyway. I'm not too happy with Springfield. Oh, that looks good. We don't have any homeless over here. No, they sent them all over here to you, to Eugene. But I'm not real happy about that. But we'll work on that issue at another time and another way, perhaps. Anyway, many of the ideas I have, you've implemented, and I like a lot of them. And I've got so many, it's just going to take more time than what we've got here to discuss it. But I'm here to listen, and I've been reading some of the stuff, and I'm happy for it. I see homelessness every day. I work, I see them, so I approach them, and so forth. And I've learned a lot from them. And some of the stuff I share with my passengers, and believe it or not, I get pretty good comeback on most of it. Pretty good. Hey, push on. In fact, I've even had this comment: "You ought to go for mayor." I'm not in this town, so that alleviates me. But nevertheless, I got good feedback from all the people on these ideas, which I'll share with Kate later. And I thank you for having me here and letting me listen to see what you've got coming for today. I don't know how much time I'm allowed here, but I could give you just some ideas.
I didn't set a timer, so I'm not actually sure.
I think we usually offer
About 3 minutes.
3 minutes.
Yeah, see, that's why I say I'm going to have to share with Kate the depth of it. And I thank you all for having a committee such as this. And I didn't know whether to come here about that. And I've got some other things for the city, but I need a number for the city council, perhaps. Yeah, good. I've got something for them, too.
Well, that's me.
Oh, I see.
Or
Yeah.
Eugene. I'm Eugene Mayor, so I can.
Oh, that's right. Yeah, and it's about the price gouging. And I'll get to that and explain what I've got in that one. It's interesting. But
Thank you so much.
Thank you.
Yeah.
Do you mind leaving your contact information? so
I have with Kate.
He did,
Kate's got
yep,
it.
so I
Great.
can share.
Good, very good. Thank you, folks, and I'll be listening. And happy to share.
And here are my cards, sir. Here are my cards. That'd be great.
Excellent. Is there anybody else online or in person for public comment? Okay, wonderful. We will go ahead and move on. Our a consent agenda. So minutes from the last July and September meetings. We have new league members that are included in the consent agenda, as well as the September 23 statement of financial dashboard and disclosures. So, can I get a motion?
I move approval of the consent agenda.
Is there a second?
I'll second.
Excellent. Any discussion?
Just a quick question. I asked this last time. Are we going to get a separate report on the all-in funds?
Yes, yeah, we're just not quite there for public exposure, but I am very pleased to be able to bring one, and you should see it by the next meeting.
Super, thank you.
Other discussion? Okay, if not, all those in favor of the motion to approve, please say aye or raise your hand.
Aye.
Excellent. Any opposed? All
My
right.
vote was for the affirmative.
Thanks, Chris. All right, any abstentions? All right, wonderful, that passes. Okay, our first conversation, we are gonna hear from Catherine and I think James on the coordinated entry stakeholder group, the assessment tool that they've been working on for a while. And we're excited to finally get to see how it's gonna roll out.
I think Catherine starts us off if she's here.
All right, Catherine, are you online?
I'm here. I literally just joined the meeting, so
Perfect timing.
if it takes me a second to kind of like get my brain here. Awesome. Yay. I'm so excited to be having this conversation and bringing this to you all. There's been a lot of amazing work in the last couple of years that has kind of gotten to this point. So, all right, I don't know who's controlling slides. They're just happening magically, which is kind of cool. And I'm gonna pull up mine too. So I can have some notes. All right, so we're gonna ultimately there's sort of two things that we're asking for like approval and a vote on in this, but we wanted to provide they're kind of big things, and so we wanted to make sure that we provided the context and background around what they are, kind of how they've gotten to the place that they're at. So you're definitely going to see that. My inclination, there's sort of three sections, would be to maybe we kind of pause between the sections and see if there are kind of clarifying questions before we move on, and then obviously have some time for a discussion at the end. So that's kind of where we're going. All right, let's go to the next one. All right, so quick reminder of just sort of what is coordinated entry as a thing. So this is a required kind of process or system from HUD for our continuum of care programs especially, but we kind of fold other things into there as well. So that there is kind of a clear channel and folks are coming into getting assessed through the same process, getting referred to programs in the same way. It's not just dependent on sort of what program you go to or who's working that day. And so you can see on the screen there these four pieces that are requirements of that system that again help create that sort of central process for getting folks prioritized and connected with programs. Go to the next one. So a little bit of background. So the VI SPDAT is the vulnerability assessment tool that Lane County has been using since we started coordinated entry in 2013. And it is something that was adopted pretty widely across the country for the same purpose. There's a lot of COCs that were using it. In 2020, Org Code, which is the organization that created it, put out this statement basically saying that there were some pretty significant equity concerns with the tool in terms of kind of the sort of scoring outcomes of it, and that they were going to stop updating it, and that they did not want folks to continue using it for that purpose. In 2021, which feels like a little mind-boggling, but it was 2 years ago, the Coordinated Entry Stakeholder Committee of the PHB was convened and began work on all of this. Last year, there was a U of O capstone group that did a whole bunch of interviews with folks who have gone through coordinated entry, service providers, kind of getting a pretty well-rounded take on it. And everyone was sort of like, this isn't the best thing. So maybe we should look at something else. And then earlier this year, our HMIS team was able to pull data from the assessments that have been conducted in our system and look at racial disparities in that. There are a couple questions that we've carried through because there were some questions that we sort of didn't do because of the outcomes of that, and then some that we did carry through based on the outcomes of that analysis. And then this year we've been working to create a new assessment tool and suggest some revisions to the kind of prioritization and referral process overall. And I do want to just take 1 second to kind of do a shout out to the Coordinated Entry Stakeholder Group. It is a group that includes folks with lived experience of homelessness, front door assessors, outreach providers, family service providers, permanent supported housing and rapid rehousing. It's a really just kind of amazing group of people that I think we've over the last couple of years have built some really good trust in each other and each other's perspectives and opinions, and I think that's what kind of got us to where we are today. So big thanks to them through all of this as well. All right. So a few kind of reasons, further reasons of why our system made the decision to start moving away from the SPDAT. If you want to click, and we'll see. There we go. Okay. So like I mentioned, there are some equity issues with it. They're around, particularly folks of color, scoring basically sort of their assessment scores coming out lower due to sort of the way that some of the questions are asked, folks' level of comfort with answering questions. There's questions in there that are really focused around accessing services, right? It's like, how many times have you gone to the hospital or the ED? And if someone is not going because of mistrust in systems and mistreatment in systems, then they're not necessarily, their experiences aren't going to be captured in the same way. And that last one, it's just, I think there's a lot of different questions in there that have components and reasons why BIPOC and white folks might have disproportionate answers. And the questions that are in there largely kind of lift up the scores for white folks in particular. And then just in terms of kind of how it works, the SPDAT was never really intended to be used as a prioritization tool like this, and especially not as sort of the sole determiner of someone's prioritization in those systems. And then they're depending on someone's experience, who's answering the questions, who is asking the questions of them. There can be a pretty broad range of what information is disclosed or not disclosed, which can affect the score. And so again, only relying on what's reported in that score has some pretty significant limitations. And it's like 40-something question. It's a lot. It sort of brings people back into a lot of the trauma that they've experienced. And so not really a trauma-informed approach to continue. All right, let's go to the one more. And this is just sort of a little bit of a demonstration about how kind of how this fits into the bigger picture and some of the systems level work that's been happening. and recognizing that in even previous to sort of earlier this year, the thing that happened was it was like your option to get connected to anything really was to get a front door assessment, to go through this long process, get put on a wait list that we know a pretty small percentage of folks actually get referred to programs from each year. And so part of some of the other broader system improvements that we've done have included adding in sort of the rapid resolution and diversion piece, so that if there are folks that resource, kind of financial and otherwise, and problem solving person to talk with can resolve their situation, we're going to do that first before we, and if that isn't going to work, then right now we still send someone to a front door assessment from there. But just adding in another layer so that we're increasing the ways that folks can kind of off ramp out of the system and not going into that deep level of detail if we don't need to. So kind of collecting the minimum of information that we need to push stuff along. All right, I'm going to pause there before I kind of go on to the next section and see if there's any, again, sort of, I think if we can hold like commentary pieces till the end, but if there's any questions that folks have. Okay. I'm going to keep going. All right, so the other, I think, kind of scoping piece as we move into these next few sections are that this assessment and the change in the prioritization and referral processes are really focused right now on adult only and adult households with children. There's separate work that has started somewhat, but that will be picking up a little bit more in partnership with the YHDP Youth Homeless Demonstration Project grant to sort of be looking at similar changes within the youth household system. So right now, our scope is those adult with children households. Okay. Why don't you go ahead and let's click through and pull up the text on all of those. So this is largely feedback from that U of O capstone project. Like I said, they talked with service providers, front door assessors, and folks who have gone through that process. They generally were like, the spit out is not that there's limitations to it. And that there's other pieces of information and other experiences that aren't necessarily captured in those yes or no questions, which have to be designed that way, in order to kind of to do that piece of it. But it's pretty limiting to have everything be based on that. And this piece around kind of discrimination around gender and gender identity, sexual orientation, and then the equity piece too. So kind of those two populations in particular, and that their experiences might be different. And we don't have any way to capture that. Chris, I see your chat message.
I'm holding for the phase 4 questions. I'm not trying to interrupt.
Okay. All right. So then let's go to the next one, which shows a little bit, just kind of a glimpsey bit of some of what we found in that analysis of our system's HMIS data around experience of BIPOC folks. So you can see on the left here, the kind of makeup or representation for white versus BIPOC in sort of census numbers within HMIS and within coordinated entry. And then if you look, so those are pretty similar for folks who identify as white, but for folks who are BIPOC, our representation in HMIS is quite a bit higher than it is in the general population. But then we would sort of expect that in coordinated entry, it would similarly be higher, and it's actually quite a bit lower. So recognizing that there is, in fact, a gap in terms of folks, people of color experiencing homelessness in our community, and then their kind of connection into the coordinated entry system and resources that go there. And then also when we look at exits to permanent housing through the coordinated entry system, the sort of rate of those positive exits are lower, folks who are BIPOC to white. So we know we have some things that we need to address. And some of these kinds of numbers are some of the things we're going to be tracking at moving forward too. There were two questions on the SPIDAT that we found, again, in our system. There were, sorry, go back. Keep going. Oh, no.
She's working on it, Catherine.
Okay, go back to the one that says the new assessment tool. I think it's two back from there. Aha, there we go. Okay. So there were two questions that where there were significant differences in responses between BIPOC and white respondents, where the answers for the kind of positive answers of BIPOC folks were higher. And one was around kind of experiences in jail, prison, holding cell, and then one about whether they were currently pregnant. And so you will see some of those carry forward, since we saw that those actually have more higher responses for those folks. And then the coordinated entry committee also reviewed a number of assessment tools that other communities have used. There has not been sort of a universal replacement for this SPIDAT that has emerged. So there's a lot of communities that are just trying different things. And so we're about to be one of those also, kind of in this experiment of trying to look at this a little differently. So on the screen, you can see kind of the questions that we landed on. I think that I'm pretty sure it was also included in the packet. The questions are kind of broken out into three domains. So there's physical health questions, mental health questions, questions about substance use, and then equity focused questions. And so each of the questions has sort of a numerical weight that they're all pretty similar. There's not any one that's kind of way higher, but they are weighted a little bit. With a kind of highest assessment score of 18 possible, which would be kind of the highest vulnerability. The things, I think, you can sort of see the star there next to number 9. Because of fair housing laws and protected classes, that actually, in this case, it is preventing us from being able to sort of explicitly use someone's race, ethnicity, gender identity, or sexual orientation as a prioritization factor. So what we did, you'll see sort of in questions 9 through 12 are questions that are attempting to get at the lived experiences of some of those folks. And like I said, that number 10 around time in jail, prison, juvenile detention. And then there's a separate consideration that I'll get to on the next slide around if someone's pregnant, were ones that we saw in our data at higher responses for BIPOC folks. And then similarly, the questions 11 and 12 around foster care and kind of multi-generational households are ones that more so in other systems have been used, again, sort of as a proxy for experiences that that other data show are more likely for those folks. What do you do? If there's anything else I want to say on. Okay. let's move on to the next one. So the actual assessment, you know, you see here sort of, it's like, there's the questions and then there's a yes or no answer for them. So they, like similar to now, will be conducted by trained assessors through street outreach, shelters, day access centers. Once this hopefully gets approved, James will start moving on getting training scheduled for our current assessors on the new tool. They're entered into HMIS sort of using the same process that we have used for the SPIDAT in the past. And there we go. I noted this assessment has 14 questions compared to 48 on SPIDAT. So just sort of, again, trying to be a little more trauma informed and just less like literal time and just like emotional mental time of kind of going through so many questions about so many hard things in life. And again, sort of there's a little bit of variation in the value of points. I think the way, what I will say about the weighting is we sort of did it so that those 4 areas, the substance use, mental health, behavioral health, and substance use, behavioral health, physical health, and equity questions as a group all had the same weight. And so in some of those sections, there's more questions, and some of them there's fewer. But the idea is that each section is weighted in the assessment. All right, let's go to the next one. Okay, so after someone completes the assessment, households are prioritized based on their vulnerability score from that assessment, inclusion in any of the subpopulations listed there, which is someone in the household is pregnant piece shows up there, and then their chronic homelessness status. So for houses with adults only, this is sort of giving a little extra bump up to folks who have a ventilator, oxygen, some kind of medical device that needs power. Households where someone has a physical disability, and households where someone has an intellectual or developmental disability. And then for households with children, if there is someone under the age of 6, if someone, again, requires that medical device, and if someone is currently pregnant. So then they'll be placed on the list sort of based on that vulnerability, these populations and chronic homelessness. And then we'll get to kind of some differences in how they get referrals next. And then there'll be there's actually, I think it's the next slide. Yeah, let's go to the next slide because I think this is getting at that one. And then if you want to click through, I think this to me was a really helpful way to kind of understand sort of the way this process works, like after the assessment is completed. So they'll go on sort of this prioritization queue, which is based on those 3 things I was just talking about. And then they would, based on the kind of piece James is going to talk about next, there would be some case conferencing, talking with the household, kind of additional data and information that we can add in. And the coordinated entry team will work, kind of connect with them, make sure that they sort of meet the eligibility, have all their stuff, documentation and stuff that they need. So that's kind of the first step. And then from there, they move into the referral queue once sort of all those, boxes are checked, everything is sort of sorted that, yep, it's appropriate to be referred to a program. And then when there's a program opening, folks will get pulled from the referral queue. And if there's multiple households on there at a time, based on sort of, again, combination of those 3 factors. So there's kind of, we're adding in like a little bit of process along the way, in part to try and make sure that like when a referral gets open, there's a household ready to go into that program, right? And we're not spending a lot of time waiting to try and find them, get documents together, sort of all that piece is done at a time. All right, here is our second pause point for questions. That was a lot of freaking information, and I recognize that. So again, there's clarifying questions, anything you would like me to go back to on the slides or anything, go ahead.
I think Chris had a question, and then Mayor Venice. And I see Donna as well. So Chris?
Thank you. And thank you for this presentation, Catherine and James. This is intense and this is good work. Some of the feedback and questions I got while hearing from folks who currently perform the front door assessments, it said, as we transition, should we adopt this? Will people with high vulnerabilities be able to maintain their current scores until their FDA expires, and then this is implemented for after that time point? Or is this something that we're going to make everybody who just did it even have to do this again and possibly make them feel like the path that they went on that's so traumatic, all those deep diving questions like you highlighted on, and do it all over again?
Great question. The committee talked through sort of a transition plan, which I haven't looked at it since we talked about it a few months ago. So we can share out a little more information, but the gist of the idea of it is that we will have like a few months long transition period where folks are, any new assessments that happen be through the new, with the new tool, but old assessments will carry through. And we talked about it's like if someone's is about to expire, you know, we're going to carry it through to kind of a set date. And at that point would be the point where sort of referrals are happening based on the new assessment process. And part of the work during that period of time with the county's coordinated entry outreach team would be reaching out to, you know, kind of the top set of households in the adult and adult with children current lists, and working with them to, you know, seeing if they want to do a new assessment, explain, you know, just kind of making sure that they know what's going on and what their options are. So some kind of proactive outreach on that side as well.
Just a quick clarifier for that on what you just said, if I may.
Yeah.
If someone is from a group that has been historically given lower scores, they could, even though they have an existing FDA or VI SPDAT rather, could they, you're saying that you will be open to the idea that they could reassess under the new tool if they wanted to, but they could also be given kind of a timelined support if they wanted to maintain their current status?
Yes. Yeah, there will be a cutoff point where we are no longer using the old scores because just kind of trying to mix and match different tools just isn't really going to work.
Yes, ma'am.
But yeah, we're trying to be really thoughtful about like what that time period is and what's happening. What are the activities and communication that are happening during that time to make sure folks are kind of, again, know what their options are and are sort of ending up where they want.
Thank you so much.
Yeah.
Okay, we have several folks in the queue, and we have about 8 minutes left in this portion of the presentation, so just heads up. Mayor Venice?
Just a quick one. Catherine, thank you for all of this and for all of this work. You mentioned several times that the responses are weighted. We can't tell from looking at these questions how that works. So I just don't know if you can clarify what is that weighting system? How does that play out?
Yeah, it's the way it's basically, I sort of explained it like a little later. The weighting is to achieve an outcome so that those 4 kind of domain areas are equally scored, if that makes sense. Or sorry, 3. So physical and mental health make up 33% of the score. Substance use makes up 33% of the score, and the equity questions make up 33%. For example, there's only 2 questions under the substance use section, so those individual questions sort of have more points versus under the equity section, there's 4 questions. So it's sort of jiggered that way, so that overall those categories are sort of equal, but because the different numbers of questions, an individual question might have sort of more.
Okay, thank you.
Is that helpful? Okay.
that does it.
Great. Donna?
I'm sorry for that delay. And thanks about this. 14 questions is awesome. I am curious who this is reviewed by, an assessment, like how many people make up the coordinated entry team that reviews the assessments? And when case conferencing happens, who is doing the case conferencing? Is it anyone that is doing outreach with the people, you know, direct knowledge of the person who's on the assessment? Yeah.
Yeah, I think I'm going to answer part of it and then hold part of it for the final section that James is going to talk about. So the assessment is done by one person who enters the answers into HMIS. And then that's the score. The only thing that the kind of HMIS team does is look at it. And if there's anything, you know, that doesn't make sense for some reason, then they would kick it back and say, hey, you need to fix this. But then the case conferencing piece is more incorporated into kind of how referrals are going to be moving forward. And so James can speak to who's in those conversations and how this works.
Right. That's what I'm interested in. What happens after the assessment? Thank you.
Okay, look, we have one other question in the chat, and then I think Debbie and I are both going to hold our questions till the third section. Lori has asked, has the new tool been piloted? If yes, have those assessed been asked for feedback on the new tool?
Great question. We have not done that. What we did do was send out the assessment questions to a number of different kind of organizations, partners, all, you know, a bunch of different people, and sort of asked for feedback on it and did make some adjustments and changes based on that. I think there is, and this again, we'll talk a little bit on the next section. There's going to be a lot of kind of continuous improvement work on this moving forward, and we are planning to be regularly going back, looking at what's in there, connecting with the folks who are doing assessments, being assessed. Like that's all sort of part of our plan for moving forward into this process.
Okay, great. James, sounds like you got it.
Yeah, is this on? Cool. Recognizing we don't have a ton of time, if I go through this too quickly, feel free to interject with questions. So I'm going to talk a little bit about what happens after the assessment happens and talk specifically about what's known as dynamic prioritization versus static prioritization, which is what we have been using for the last 13-ish years that we've been doing this. So static prioritization, this is a graphic. So in our current system, households are matched to the housing project type solely based on their assessment score. So households that score above a certain score range are automatically would be sent to PSH. Scores that are lower would be sent to rapid rehousing, and there's no mechanism for being able to actually identify if one program fit may be better than another. In addition to that, the vulnerability is just measured at the time of assessment, and folks remain on the CWL for 6 months. Obviously, in 6 months, someone's vulnerability can change significantly. So that's the piece we've been talking about without a case conferencing component. There's no way to kind of update information or influence where someone gets referred. In a static prioritization model like we've been using, it leads to these what are called referral buckets. So it's those areas, those ranges of scores where folks just aren't getting referred. So an example of that is, you know, in our current system, and I recognize it's confusing because this graphic was created by someone else, and those numbers don't directly correlate to the numbers that we use. But in our system, if someone scores a 10 or higher, 8 or higher, that puts them on the permanent supportive housing list. If someone scores 4 to 7, that puts them on the rapid rehousing list. Any lower than that, we would expect that they would be able to self-resolve through connection to mainstream benefits. What happens is we have so many folks who have SPDAT scores of 14 and higher that those folks that are 8 to 13 are never going to get referred anywhere, but they are more vulnerable than those households who are 5, 6, 7s. But they're just going to sit there and not get referred because they're falling in that bucket. And it leads to these pockets of folks that just are going to remain on the list, and despite being more vulnerable, are just not going to get referred to a housing project. One thing to note too, with our current prioritization model, 60% of the households that are on the CWL fall into one of these buckets. So the majority of people on the list are not going to be referred, and that includes a large percentage of those folks that are actually more vulnerable. If you can go to the next slide. So dynamic prioritization is about matching folks to project type based on real-time information. So it's taking that case conferencing component. So to go back to Donna's question, case conferencing, the folks that will be a part of case conferencing are the folks that are working with these households. So a myriad of folks, service providers, McKinney Venture liaisons, outreach workers, whoever has a real clear picture of that household, their needs, someone that's actively engaged with them. So as that real-time information comes of changing vulnerability, we can update that to really get a clearer picture of their prioritization. With dynamic prioritization as well, we're moving away from those designated lists. So there will no longer be a rapid rehousing list and a permanent supportive housing list. Folks on the centralized wait list will be eligible to referral to either of those projects and to the other projects that pull from coordinated entry based on the project type that's going to best suit their needs. So no longer will it be, oh, you could only be referred to PSH. And again, that real-time piece, if circumstances change, the household can be reassessed. We can use case conferencing as a way to update information. And then back to kind of what I was saying, and actually if you can jump to the next slide, I think it shows it a little bit better. So on the left is that, what we've been working in with static prioritization. As we move to dynamic prioritization, the full range of the most vulnerable folks that are identified in the community are going to be able to be referred to those housing types that are available and are no longer bucketed to one or the other. In addition, and over the last couple of years, as you all know, we've really started to increase our diversion and rapid resolution responses, which helps to engage those households that are the lower vulnerability households that really just need that light touch. Sometimes it's not even financial. Sometimes it's a problem-solving conversation. It's helping them to address barriers that they have. They've been kicked out and they just need to have a conversation with their family members about how they can get along and move back in. And so we've seen a lot of success with diversion, and we expect to continue to see that intervention be able to help a large percentage of the folks that historically have been sitting on the CWL without getting assistance. One thing to note, we have kind of by default started to have some of this happen. So with the family list, rapid rehousing list right now, because our community prioritizes chronic homeless households, we have had frequent times, where the rapid rehousing list for families does not have any chronic households on it. So we have moved to the lower scoring PSH range households. So our providers have started to serve those higher vulnerability households. And I would say, and I know Foster's here, and I would say St. Vinny's has done an excellent job of, being able to work with those households that traditionally just never would have gotten referred to a rapid rehousing project. And we've seen real success. And we've utilized our existing families case conferencing meetings to really talk about the unique needs of those families and how can we connect them. So I anticipate that as we move to a larger system-wide dynamic prioritization, that we will, through case conferencing, be able to really match folks to that project type that's going to best serve their needs, and be able to support the providers that are doing that work. I think that's it for dynamic prioritization. So the next slide, and this also touches on a question. So, HUD really emphasizes that coordinated entry should be ever adapting and ever changing. We should not spend another 13 years using the same assessment tool, using the same process. We should be constantly doing quality improvement. So, I think we really see this next 6 months as this is the pilot, is from now to, if approved, is from now through the next 6 months. And so after that first 6 months, or during that 6 months, we'll continue to engage with stakeholders, including the Coordinated Entry Stakeholder Committee, and then specifically culturally specific providers. And that's what Catherine was touching on. The assessment tool was sent out to about 50 different representatives of culturally responsive agencies and individuals with lived experience to review that tool. So we have started some of that, but we will continue to do that over the next 6 months. We'll also use the same methods that U of O capstone group used to analyze whether or not the tool successful. So interviews with folks who have been assessed, interviews with assessors, interviews with other providers, and then we'll really want to compare data, the data elements that Catherine shared, and I have a couple on subsequent slides, to make sure that the changes we are making are addressing those equity issues and that we're seeing it in the data, because that's really, a key piece of making these changes. Next slide, please. So this is just a little bit more in-depth of a breakdown of what those bar graphs on the earlier slides showed. And so in an equitably accessed coordinated entry system, we would really want to see that there's the same representation of BIPOC clients being assessed through coordinated entry as there is in the larger HMIS system. So, there's an overrepresentation of BIPOC folks in HMIS by 8.3%. We would want to see that same overrepresentation in coordinated entry, because it would imply that they are accessing coordinated entry in the same ways. One thing to note, which I highlighted, I think we will want to look at all racial and ethnic breakdowns groups to kind of see who is being served equitably and who isn't. I highlighted Asian population because of the higher discrepancies. So they're being underserved compared to their census numbers. And so I think over the next 6 months as well, we'll want to do a real critical look at why certain populations may have over or underrepresentation. And it may be an issue of outreach, advertising of coordinated entry. So we'll want to spend a lot of time in the next 6 months digging deep into those. Next slide, which is, I think we have 2 more and then we're done. And this just shows who's getting referred to rapid rehousing and who's getting referred to permanent supportive housing. And so we would want to see that the representation in housing programs should match the representation in that larger system and in coordinated entry. So we would want to see that there's consistency across the board, which would indicate that there's that an equitable system is in place. And then the last slide. So this, again, I think one thing to note, which I think is a real positive thing, is to look just over the last 6 fiscal years. We have seen a pretty steady increase in the exits to permanent housing from coordinated entry, which indicates a real improvement in the system. What we will want to see is those numbers between white households and BIPOC households. We would want to see those closer than they are, which would indicate that all populations are being served equitably. So that's something as well in the next 6 months. We'll want to make sure that we're looking back on this data to make sure that that we're seeing those shifts. That's it, unless Catherine has other things, but happy to take questions that either Catherine or I can answer.
Okay, we have room for a couple. Debbie, do you still have one? Okay. I'm curious how many folks are currently on the list. And we talked a little bit about this gap of people who are not getting sent either direction, mostly being a problem of we don't have enough housing to put people in the first place, right? So I'm just curious, the number of individuals who are on this centralized wait list, and then also what types of referral, who is a part of the referral system? Because we know it's not the shelter, not all the sheltering sites, but so for those who are unaware of the actual process, who are the entities that people are getting referred to?
Right. So we fluctuate between 800 to 1,000 households on the centralized wait list at any given time. Historically, about 20% of those households will be referred to a project. I'm glad you brought up that distinction, because it is important to note that coordinated entry talks is really specific about the housing types that are referred. So it's permanent supportive housing, rapid rehousing, some of the new YHDP that's right, projects, the joint transitional housing, rapid rehousing, and then there's a transitional housing youth project. So it's real specific. It's about 25-ish housing programs that are operated by local providers. MLK Commons, the NEL, those are the the Keystone. Those are the projects people are probably most familiar with, but there's a variety of scattered site where they help folks get into their own apartments. I think Catherine touched on this at the beginning. We have, since its implementation, really kind of sold front door assessment as this is how you get access to housing if you're homeless. And so it's going to be a shift as we get into training on this new process and this new tool. It's going to focus heavily on diversion and training assessors to, the first step shouldn't be jumping to do the vulnerability assessment. It should be, can you identify a pathway to housing? And it may not be that person getting into a rental of their own. It may be, are there friends? Are there family? Are there people, coworkers? Are there people you could double up with? And that's a way to kind of work around the housing inventory challenges that we face. But the hope would be that we would have a centralized waiting list that is significantly smaller, that the majority of folks are being helped through diversion and mainstream resources, and then really those most vulnerable are prioritized for referral to the housing project.
The one thing I would just add in really quick, and that we have to remind ourselves in this committee regularly, is that what we're looking at is sort of how, by what process, and with what tools do folks get connected to the available resources in the system. We're not increasing the resources that are in the system through this particular work. So we're trying to make it a better, smoother experience and more clear and just understandable for folks overall. But we still have limited resources to actually connect folks to.
Thank you. I see Mayor Van Gordon and then Mayor Venice.
Yeah, thank you. Great presentation. I guess the two questions I had was, if it's a pilot, what are the, what's success defined as?
I would say it would be looking at that data that I was the equity data, and it would be seeing that we are matching representation. Sorry, I feel like I'm right on top of this. Matching representation and coordinated entry with the larger system, and that we're seeing the same exits to permanent housing across racial and ethnic groups. And secondary to that, through the surveying process, this should be a more trauma-informed process, and this should be a better experience for the folks being assessed. So I personally would really want to look at the survey results we get from those folks who have been assessed to determine if this has been a positive change.
And I think my second question is more around I guess, time per assessment, right? Like I hear a lot of user experience pieces being discussed, right? But are you measuring how much more time we're spending per assessment at all?
I mean, I think we're just assuming by cutting down from 48 questions to 14 questions that we're assuming the time spent will be significantly less. I don't know that that's an interesting suggestion. I don't think we've specifically said we're going to time assessments. Part of it is, having been a front door assessor in the past, some people, the assessment experience can be different for everybody. Some folks don't want to share much information. Some folks are telling you everything. And I've had assessments that have taken 10 minutes. I've had assessments that have taken an hour. So it's hard, I think, to put a time on it and be like, we want all assessments to be finished within 20 minutes, because that's just not the reality. But I think through these reduction of questions, we will see a shorter time frame.
Yeah, so the questions coming back from when you go through large change management, right? It may still feel clunky, hard to do the first few times, and by not to measure the back and forth between the two, but to gather some sort of even some empirical data will help people adjust to it, because you can kind of take into account the training, if you will, right? Because it may feel slow and clunky the first few times you do it because you've only ever done one or two of the new assessments. So it might be worth looking at.
No, that makes sense. And I think in addition to that, the surveying of the assessors after that first 6 months also will be telling along with that, but that's a good point.
Excellent. Mayor Venice?
Yeah, thank you. So this is so interesting, and I am so grateful to you for your work. And just a comment that James made sort of towards the end around diversion, and recognizing that a lot of our sort of shelter responses don't qualify as housing. HUD doesn't, they're not So I'm just wondering, when you're thinking about diversion, are you also thinking about some of the non-congregate sites that we've set up around the community? Does that count, or people coming through those sites, or can they go to those sites? I mean, are they integrated into the thinking about this system?
I mean, obviously, we want to connect folks to resources that better their situation. I mean, diversion at its core is really about diverting folks from needing the homeless service system. So it wouldn't be about diverting someone from unsheltered homelessness to a shelter. That being said, you know, if that work can be done, that would be done. But diversion is really about finding links to permanent housing.
So saying that, where does that shelter system fit into this
Yeah, if
process?
we have time, but the slide, the system map slide, and I don't want to get too far into this because this is a whole nother piece. is the
You don't
shelter.
need to give a dissertation on
Yeah,
it, just a
but
quick
it's the idea is that so someone is experiencing a housing crisis, ends up at one of these access points, outreach, a day access center, whatever. First step is diversion, problem solving conversation. Can we get this household into housing immediately? If that then is not an option, that's when we're moving to talk about assessing need. So do they need shelter? Can they access shelter? Do they want shelter? And then we're working on a real-time shelter inventory, a shelter app. That's more to come. That's the way we would connect them to shelter resources at that point. It fits under a phased assessment model, which is another whole can of worms I won't get into, but it's assessing their needs in the moment rather than the system we've done, which is do this in-depth front door assessment and sit on this wait list. Like,
Thank you, that helps.
Okay, so the intention was to vote on the new assessment tool and the new coordinated entry policy, which both were in your all's packets. The assessment tool questions were on page 17, and then the policy is page 19. So, open to if folks feel comfortable voting on this. A motion. If there's any reason that we want to wait, also happy to hear that feedback, so. Ask if this is for a motion to pass the new assessment tool and, or the coordinated entry policy.
Excuse me, Madam Chair. I'll move that we approve the new coordinated entry assessment tool and approve the new coordinated entry policy.
For a second?
Second.
2 seconds, thank you. All right, discussion. Any further questions or discussion items?
Just one thing, and this is just a note of cheers and thanks to the team that put this together. Catherine, James, excellent presentation. You covered a lot of bases, answered a lot of questions. We could have gone on for an hour talking about it, but well done. Thank you.
Okay, if no other questions or discussion, we will go ahead and take a vote. All those in favor of passing both these policies, please say aye or raise your hand.
Aye.
Aye. By raising hands and saying aye, you get 2 votes, right?
Okay, thank you for those votes. Anyone opposed? Please indicate by raising your hand or saying aye. All right, any abstentions? Wonderful, thank you all for that work. It passes and appreciate that. We're gonna do a little bit of an agenda shift. Felt like that conversation was important enough. We wanted to give it as much time as possible. So we are going to go to, we're going to pass the Built for Zero conversation for today in hopes that we can put that on the agenda for next month. Is that
Yes.
right? Okay. So COC application priorities. Amanda,
Yes, thank you. And I recognize.
if you can shave a few minutes, that'd be great. Thank you.
I'll go through this quickly. I don't think it's super critical that we go in depth. This is kind of a follow-up to our COC application process that you're all well aware of. We presented and this group approved us submitting that application recently. Feels like forever ago already for me. But this is sort of a follow-up to that and looking at kind of priority areas that we need to look at overall as a continuum of care to improve upon our overall system, as well as improve upon specific points within that application that we maybe are scoring lower on or don't have a lot to say in terms of our strategies or what we're working on in that area. So I kind of, after the application each year, kind of formulate a list of things that I will work on or try to work on. It always comes up much more quickly than we anticipate, and there's not actually a lot of time in between. So we thought we would bring that to this group this time around, just to sort of be transparent about some of the areas that we need to work on, but also so that this group could maybe provide some input to me and our team around what maybe we should be prioritizing. I have obviously thoughts about what I would like to prioritize or what I think is important, but I want to sort of hear from the larger group about what might be important to you. So I've kind of outlined a bunch of different priority areas and summarized some of the sort of goals and action steps that I see as necessary for each one and what maybe the PHB role might be. So that might be to assign it to a committee or to staff, or simply to discuss it, or it might also involve an approval of a policy of some kind, or simply to stay informed on that topic. And so all of that's up for discussion as well. So some of those priority areas include domestic violence system improvements, really developing providers so that we can anticipate and having an application for that DV domestic violence bonus opportunity. There have been times we've applied and not gotten it, times that we haven't submitted an application because we don't have the capacity to submit a good project there. And so lots of things to do there, as well as just filling gaps in our domestic violence system overall. COC standards, we have continuum of care program standards in place, but we haven't updated them in a number of years, and a lot is changing more rapidly in our community as we do a lot of system improvements. So there's some improvements and regular updates to do to that document. Engagement with tribal communities. This is something that was sort of added a couple years back by HUD. Tribal communities are now eligible to receive COC funds or become a part of a COC. It used to be not that way, and so we have not actually gone down that road as our continuum, and so we just need to sort of reach out to those tribal communities in our area, see if they want to apply for COC funds or in what way they want to be a part of our COC, if any. And so that's just been kind of on the radar for some time and haven't gotten to it. System benchmarks, we are responsible for developing system benchmarks and discussing strategies for system performance improvement. That's really focused on our system performance measures that we talk about in our COC application. So really more formally kind of outlining where we want to get to with those performance measures and steps we're going to take to get there has been something we haven't outlined as specifically. Further developing formal partnerships, there are some areas in the application specifically around MOUs with especially early childhood programs, for example, that we haven't been able to say we have formal partnerships with. We have maybe informal relationships with some entities. So really maybe just honing in on that. Increasing participation from people with lived experience overall is a goal of mine for our continuum, as well as I know it is a goal for us here. We have obviously our lived experience advisory group, but kind of expanding on that and making sure we're not just counting on that one specific group to be our participation, but really having that participation just be, as a rule, a part of all of the work that we do, and how do we kind of expand upon that. Racial equity, so sort of moving past the acknowledgement of racial equity as a topic we need to talk about and really getting into the data. What do we need to improve? Where are there disparities? And outlining some goals and action steps and a plan to do that. I think so really kind of getting into that, formalizing that racial equity plan is something we need to do. Unified funding agency, this is something we've talked about in the past at this group and whether we want to pursue a unified funding agency status for our COC. That's just something to keep on the radar as far as do we want to prioritize it before the next competition, or is it still kind of just on hold? Developing funding priorities. So overall, this is something we're also responsible for as a continuum of care and as a board. So how are we going to prioritize funding for the next COC competition when we have new funding available? We've done that more informally as a COC, but if there are discussions that we want to have around formalizing what our funding priorities are, that would be something to do as well. And then there are just a number of kind of other tasks that we need to do. COC required trainings we haven't provided in a while. We need to roll out new inspection standards that are coming from HUD and get back to doing our participant feedback processes. So that was a very quick summary of the document that you have. So what I was hoping for from this is to hopefully just get even some informal feedback around what you see as your kind of top priorities as members of this board, or if we want to, and we don't have time today, I can always hear that after the meeting, or have some time to think about it and come back to it too.
I got just a question to make sure I'm totally tracking this and on board. So this chart that you've given us is the summary of what we did last year and where you see, so is this the beginning of a chart for where we could go next year, correct?
Yeah.
And so I guess the other part of this is two things as we're thinking about strategic planning, thinking of this in the framework of strategic planning, right? So it's what are these things that we might see as priorities within the strategic planning process and folding that in. And then I guess secondly, the subject that's next up is sort of the PHB HSC roles and how this connects. So I can't quite connect the dots based on this chart, and so I would just suggest helping us connect the dots with those conversations would be really useful.
Yeah, so I can see that some of these items might kind of be put on hold in an effort to incorporate them into the strategic planning process overall, if we want to sort of think about how that really fits in the structure. For my purposes, I'm mostly concerned with between now and the next competition next summer, sort of what should I be focusing on in improving our application and our COC overall, and having some direction in prioritizing this work, because we're obviously not going to do all of this before next July. But how can we really hone in on a couple of different areas to really get a higher score, improve gaps in our system, and what would be realistic between now and then would be the top priority for me. And then I think we could revisit this list too in the strategic planning
And if I may just make a follow-up comment to that, there's no way for me to tell, looking at this chart, where the bang for the buck is.
Yeah, I was going to ask the same question.
So I have so you'll have to give us a little more framework around where could we make the most improvement that would increase our chances?
Yeah, do we get that feedback in our application process saying these are the areas where you have lost the most points, or these are the areas that are worth the most that we're not getting the full scores on? That would be super helpful to understand, like, if the goal is to improve our application, it would be nice to know if there's specific areas we keep repeatedly falling short on.
Yeah, we get sort of more general scores. We do not get scores for each individual question or even each individual area, so it's sort of a mystery. HUD has received that feedback from many COCs that we don't kind of know what we need to improve upon. I can make a guess at certain areas, and I can always share that information too of I can definitely say, as far as the domestic violence system improvements, we haven't been able to obtain that funding, and so we're sort of leaving those funds on the table because we don't score highly in terms of demonstrating our need and really outlining what we're doing in the area of domestic violence. So that's definitely a clear area where we've lost points. But some of the other ones aren't as formal in the application, but could go a long way in terms of improving what we're able to speak about in the application. So I'm always happy to dive into that and provide more information if that context is more helpful and we can put that on hold. Kate, I don't know if you have other thoughts about that.
Yeah, and we can certainly revisit this even at the next meeting. As Amanda mentioned, unfortunately it's not greatly black and white. And I think HUD does that on purpose because they really want to motivate communities to move in the direction of like a holistic system. And
Very gracious of you to say that.
to very much, prioritize within the community, like what do you consider to be the, whether it's the greatest bang for the buck or the greatest need or the gap or, just generally whomever's working collaboratively feels like this is the best path to move towards. So we can absolutely revisit this and continue the discussion.
I see Chris, and then Commissioner Farr, if you have a question as well. Chris?
Thank you. This is great work, Amanda. And in terms of priorities, I don't necessarily see this called out. And I know that as we receive federal funds as a county provider, that we have to make sure that we are very careful with how we do stuff. But if we have regional responses that meet the unique needs of each jurisdiction, we will probably be scoring better and have better, more collaborative partnerships identified. But I have people disproportionately in Springfield, people of color, with DD who do not get first past the post treatment. There's not allocations that are dedicated directly to their community, so our stuff goes underserved there in a regional response. And so if we can have regional responses and allotments or call outs to where these services will go across the board, I think a lot of these categories will backfill. I yield.
Thank you. You know, Mayor, Lucy, Kate said far more diplomatically what I was going to say, and that is that HUD doesn't help our staff interpret what they want, so it's more difficult. I think I've watched this for years now for us to tell what exactly happened, to connect the dots. HUD doesn't connect the dots. They kind of say, here are the dots, do your best. So I think, Amanda, I want to say to you, I've been watching you do this work for a long time, and you do the best with what you're given from what's rained down from you to you. That's all I want to say about that. And Kate, I'll defer to your diplomacy.
Debbie, did you have a?
Yeah, Amanda, I was just looking at the list and I was kind of thinking about low-hanging fruit, some of the things that we can focus on. I mean, engagement with tribal communities seems like one that has a lot of opportunity. The early learning partnership, you know, there's a new housing development in collaboration with Homes for Good that will have, I think it's a preschool promise site or Head Start site. I mean, so that seems like one, especially since you've already got partnerships in play. We have a really dynamic early learning group that meets on a regular basis in Lane County. And then the racial equity piece, because, you know, we're doing that work in other areas. So to me, those three areas seem like good focus areas.
Excellent, thank you. So we'll plan on follow-up next month. So folks have other comments, questions, concerns, make sure to reach out to Amanda. So we're gonna get a quick update on the All-In project and the PHB HSC we mentioned.
I'll start. I'm going to defer to Kate.
It's going really well, right? Just continued kudos to the agencies that are receiving all-in dollars, including the city of Eugene. The all but 2 of the programs that were funded through All-In are active and are serving clients. We do still have the Nancy Devereaux Center, the Florence Emergency Shelter that is developing their property in order to be able to open. But it's very exciting because they do feel like they have a path forward and that they'll be able to provide 30 ongoing beds for folks who are houseless in the Florence area, which is fantastic. And I've also recently gotten a question as to whether the winter weather shelter will open. And last I heard, it's a yes. So enormous kudos to just all the volunteers and community members in Florence for continuing to just build around the supports that are available for people who are houseless. The other project is Ant's Heart, which had hoped to purchase a home. That didn't move forward, and so they've been speaking with county staff, receiving technical assistance regarding how they might be able to make their vision a reality for 6 additional shelter beds. One suggestion is simply to be that they could place 6 people in a motel, and that very much would be additional shelter space. And so they were given a few suggestions. They're going to go back to the drawing board, see what might be possible, and continue to work with the county. We have provided kind of a drop dead date to them that if they don't have a clear plan forward, then we would reallocate the dollars to a different program. The other thing that I wanted to share is the fact that we are very close to beginning a landlord risk mitigation pilot fund. This would be for folks who were rehoused, so maybe they were living with family or friends, and through a prevention program were able to move into a new home. then whomever they were renting from, their landlord, would be able to apply for the risk mitigation fund should there be unpaid rent or damage or extensive cleaning beyond normal wear and tear that was necessary. The other group that could have their landlord apply would be those who are in the rehousing programs, and so anyone that moved from unsheltered homelessness or an alternative shelter into permanent housing through rehousing assistance would also be able to have their landlord utilize the risk mitigation fund. The maximum amount of dollars that a landlord could recoup is $20,000, which is higher than other programs that we're aware of. And many of the aspects of the risk mitigation fund are a direct result of feedback and survey results that were received by our office, thanks to landlords that gave their time through the survey and the conversations. So we know that landlords are an incredibly important partner in the work that we do, and we want to try to help them be whole when something negative occurs. So we're hoping to roll that out next month, and we'll keep folks updated. And then lastly, we have the Tableau dashboard that is available for the public to view. You can access it through the Lane County All-In webpage, the bottom accordion, and Brianna very kindly pulled it up. This was updated the beginning of this week. An enormous celebration for surpassing our emergency shelter outcome. That is much to the credit of the City of Eugene, their cohort partners, and other emergency shelter providers that have indeed made improvements to meet the emergency shelter definition. We're over a third of the way in achieving the prevention goals, as well as a quarter of the way to achieving the rehousing goals. The last thing I'll mention is the rehousing program outcome. The outcome is achieved when a household is exited from the program. And so there are many more households, like over 100 more households that are being served through rehousing, but they just haven't actually been exited to a permanent location, and so they're not showing up on the dashboard. So go ahead.
Just one thing that Kate's not going to say. Kate, by the way, is our Human Services Department Manager, recently appointed. Congratulations on that.
Thank you.
But our dashboard is up to date. It's kept up on a regular basis. No other region has a dashboard that is as up to date as ours, and a lot of people sitting in this room are the ones that make that happen. But for instance, the state is about 2 months behind on their dashboard. So don't look at the state dashboard, look at ours. And Kate, bravo to you and your team for making that happen.
Thank you.
I've sent the link along to a couple of people sitting here, but I think the link is probably available easily online.
Yes.
I just have a question because I didn't fully understand until James reiterated it today about 25%. Because it doesn't look like we're really achieving, by the end of the year at 25%. Is there any quick way that we can just say how many people are being helped with rapid rehousing versus how many have exited?
I'm looking at Kirsten because she's the data holder.
Oh, Kirsten, I didn't see that.
I don't have it calculated off the top of my head, but I could
Yeah, that would be really helpful.
And actually, I think I totaled, and it was 191 households was the last data set that I saw.
Yeah,
So,
and our goal is 247.
yes.
So, yeah, so we're close.
Yeah, and it was 191 plus 62 would be our number. So we're there.
We hope to shatter goals, however.
Well, and the other piece is there are realistically some households that may not successfully be able to get into permanent housing and stay there. But staff, I will say, are doing an extraordinary job of having regular conversations with the programs to help them think about how they're going to be able to achieve their outcomes and what they need to be doing now. For example, taking a certain number of referrals each week in order to be able to get close and or achieve or blast by the outcomes that are expected of them.
So if I understand that, you were working with enough individuals to hit our 247, but only 62 of those so far have actually exited.
Correct, exactly.
Excellent, okay.
All right, so I'm going to transition over to the Human Services Commission and the Poverty and Homelessness Board reimagining. At the last meeting, I appreciated the asks from Mayor Van Gordon and Mayor Vinnis regarding one pager to describe the process thus far and where we are moving with the process moving forward. On page 27 is the one pager that's been created. And the key, I think, regarding where we are today is under next steps. And so both the HSC members as well as the Poverty and Homelessness Board member have transitioned to a small group who are looking at the respective charters. We worked with myself and Kachina. Kachina's taking lead on the Human Services Commission, are working with a consultant to kind of scrub the charter based on the feedback that's been provided. And we've now shared those draft charters with each respective group. We're meeting with those groups right now. The Poverty and Homelessness Board group includes Matthias and Brittany and Catherine and Terry Shea, as well as Amanda. And they are providing feedback, making suggestions, and then we're continuing to revise as requested. And then once there is a kind of final draft, at least based on the Charter Review Committee members, we'll bring that to this group, which I'm looking at hoping to do November 30th, which is our next proposed meeting. And then we'll deep dive into the charter. You may also notice that the meeting is a little longer because we're combining the November and December meeting. We were looking at a 2-hour meeting so that we could dig a little more deeply into the charter and a few of these other pieces. So after the charter review committees move the documents to the two respective groups, then they'll be reviewing and eventually we would look to each group to adopt the charter, and then the charter would go to the Board of County Commissioners. And then after that, the Poverty and Homelessness Board would move forward in implementing the charter. The next steps for the Human Services Commission would be going to the IGA and seeing if we can get signatures from all the different jurisdictions.
May I just add one note about the Poverty and Homelessness Board? The Board of Commissioners has always recognized the importance and significance of this board. I just want to point out that this board right now is being televised live. The broadcast will be repeated on Channel 25. It's only two committees of the Board of County Commissioners that is televised live. It's this and our Budget Committee. That's the significance of Poverty and Homelessness Board.
And then I'm also going to say, I'm looking at the packet and I don't see a back page to page 27, which means half of it is missing. So I apologize. This is the half that's missing. I'll be sure to send a follow-up in the next few days so that everyone has the full document.
I have that. I got it on the digital.
Mayor Van Gordon?
Oh, it could just be
Came through on the
mine.
digital.
I know we're short time, so maybe Kate, if you could just give me a call this afternoon.
Sure.
And I'll ask my couple of questions.
Absolutely.
Thank you. Okay, so we are gonna bypass committee updates. Next meeting, we'll make sure to have those updates available. Speaking of next meeting, Kate mentioned that November 30th, we'll have a little bit longer meeting from 12 noon to 2 p.m. So make sure to make note of that. I'm sort of in the danger zone as whether I will be here on November 30th. We're getting very close to my due date at that point. But Commissioner Farr has agreed to chair if I'm not. And at that meeting, we'll be talking about board chair and vice chair nominations. So if you're interested in serving as chair or vice chair, please make sure to reach out to Kate, let her know so we know if there's interest. And then we have open seat applications that will be available soon for the PHB. So keep an eye out for that as well.
Okay.
I believe that's all.
It's,
I agree.
what's the?
Noon to two.
So
Noon to
full
2.
all-member
Thank you.
meeting on November 30th.
Is it
Here.
Correct.
Yes, here. And then the next executive committee meeting will be January 18th. Excellent. Okay, if there's no other business, we'll go ahead and adjourn. Thanks, everyone.
Thank you.
Thank you.